Hello everyone, and welcome back to another episode of Acupuncture is My Life. Now, in today's episode, I'm going to speak on a topic from a young lady from Alaska. Now, she'd recommend she remain anonymous, although I can state where she's from. She wants to, although wanting to remain anonymous, she requested that this topic be discussed so that it can help many women out there that are going through this problem. And that's dealing with perimenopause while experiencing fibromyalgia as a disorder. And, she doesn't personally know of too many people going through this combination, but she's sure that there are many women globally that are facing this and felt it needs attention. And also, she didn't realize how much acupuncture could have helped her in so many ways. I mean, starting like years ago, when she was first diagnosed with fibromyalgia, it's just that she'd happened to stumble across in a post on one of Acupuncture is My Life social media platforms discussing pain. And she looked into it, and she'd stated she began to look at previous postings and was looking into like the newsletter she subscribed to, and couldn't believe, like, all this time, instead of having taken so many drugs and tried to sort of suppress certain symptoms with over-the-counter medications, she could have turned to acupuncture along with seeing her doctor. And she felt, after going through so many years of suffering and dealing with so much pain, she could have made out much better, and her life would have been so much different for the better if she had included acupuncture treatments in her therapy program. Because she had stated, like, for several years, she was dealing with bouts of fatigue, and energy was very, very low. But then, along with other things, and all of a sudden, the fatigue had taken a turn for the worse. Where she began to feel so tired that she would just get up in the mornings to eat and then go back to bed. Same for lunch. And sometimes she would skip dinner, and her migraines really had gotten worse, because at one point she was beginning to get used to the migraines. But then, along with this abrupt turn for the worse relative to her fatigue, the migraines had worsened as well, which caused her to become more frustrated, where her daily activities would just become too much of an effort. Now, this is why, again, I have to keep saying this. This is why Acupuncture is My Life is constantly saying, follow us on every social media platform under Acupuncture is My Life. On Twitter, we're at Acu_is_my_life. You can follow us and watch YouTube videos under Acupuncture is My Life on the Acupuncture is My Life channel. Or go to the acupuncturemylife.com website and subscribe to our newsletter. There's just so much information out there. And you never know, something can pop up that relates to a disorder that you're facing, and it's like, wow. And you can learn how acupuncture can be of benefit to you as an adjunctive form of care, along with, therapy from your regular doctor or physical therapist, what have you. As well as it can serve as standalone care. But in dealing with migraines for so long, acupuncture has an awesome reputation for treating migraines. And I've been extremely successful with it. I mean, I've dealt with patients who were dealing with migraines since they were 16 and couldn't believe coming to me at the age of 51. And after several treatments, they had gone 2 years without experiencing a migraine. There's so much involved with acupuncture. And as I explained to this young lady from Alaska, the fatigue, chi deficiency, chi and blood deficiency, these are possibilities. Again, I have to reiterate, I don't speak in absolute terms with regard to diagnoses. I speak in terms of possible diagnoses. But fatigue, lack of energy, low energy is a sign of chi deficiency. Acupuncture is great for that. Reinforcing chi and blood. That's a treatment protocol as part of wellness visits. And this is why I say over and over, seeing an acupuncturist and just getting your weekly, bi-weekly, or monthly wellness visit, you can avoid so many problems, simple problems, just keeping your body balanced. But as for this young lady, she was attributing this sudden turn for the worse to her fibromyalgia, in which she was diagnosed with. So I recommended that she get blood work up, see her doctor, request a CBC, and then get back to Acupuncture's My Life, and she did. Only to find out she was experiencing symptoms of perimenopause. She was perimenopausal, and she was shocked and elated over the fact that she had contacted Acupuncture's My Life, because she wouldn't have thought to just go get blood work up, and for it to come to what it came to. Because going into detail with her and explaining to her like tiredness, headaches, her issues with concentration, depression, aches and pains, sleep problems. These can be symptoms of fibromyalgia, which can be exacerbated by the changes that usually present as a result of perimenopause. Because symptoms of perimenopause can include irregular periods, hot flashes, sleep problems, mood changes, vaginal and bladder problems, a decrease, of course, in fertility, changes in sexual function, loss of bone mass. And I'd even requested that she go get a bone density exam as well. Because here at Acupuncture is my life, it's not just one way and that's the only way. We work with doctors of different specialties, and sometimes we don't have to. Acupuncture is enough for many people. But to just, get blood work up, other types of exams done, can only help. And this is why I say, see your local acupuncturist or contact Acupuncture is my life when you're faced with different disorders. We engage in so many telehealth conferences, assisting people in giving them alternatives. But she was also surprised to find out, this young lady from Alaska, was, changes in cholesterol levels. And she had noticed an increase in her LDL cholesterol, which is your bad cholesterol as well, which supports symptoms, perimenopausal symptoms. And acupuncture treats all of this. Acupuncture is great for gynecological disorders and dealing with infertility, as well as others in which, I just stated, tied to your menstrual cycle, menopause, the whole process of birthing, and so forth and so on. Acupuncture treats so many disorders that many people are unaware of, but relative to dealing with both perimenopause and fibromyalgia, I can understand what this young lady's faced with. And just the fact that, it's great to see how we can help many people globally more and more understanding and turning to Acupuncture is my life. Even if they don't necessarily act on it, it's the information that's important, that's very powerful. Because it's all tied to the health is wealth factor that I keep saying over and over. And she had a basic understanding as to what causes, this menopausal transition. I just reiterated, it's her body's production of estrogen and progesterone, which rises and falls. The many changes that occur as a result of decreasing estrogen. And I'd explained to her some of the risk factors include smoking, and she smokes, and she wants to change that, make it a healthy effort to stop smoking. And I told her, you have so many reasons to see an acupuncturist as soon as possible, because acupuncture can help you stop smoking, but you have to speak to your acupuncturist about that. But other risk factors include family history, cancer treatment, because chemo or radiation therapy or pelvic radiation therapy, it's been linked to early menopause. Also, of course, another risk factor is hysterectomy. But when it comes to the complications, irregular periods are the hallmark of perimenopause. But most of the time, this can be normal. So I don't want young ladies to stress out about it. But of course, under certain circumstances, it's best you see your acupuncturist right away as well as your gynecologist. You know, when you're experiencing like bleeding that's extremely heavy, and you notice like you're changing your tampons like almost every hour. Also, bleeding that lasts longer than 7 days. See your acupuncturist right away and see your gynecologist. Another complication to see your acupuncturist as well as your gynecologist is bleeding that occurs between periods. As well as periods that regularly occur less than 21 days apart. You know, this young lady was also concerned, like, what's the average age for perimenopause? And it's usually around 51, give or take. And she's like in her mid-40s. But perimenopause can last for somewhere around 4 to 8 years. It's so important. See your acupuncturist. They can help you through this process. Ease the complications. There's so much an acupuncturist has to offer. But like, how do you know? I mean, although I've explained this, how do you know if you're perimenopause? Is if you have a persistent change of 7 days or more in the length of your menstrual cycle, and you may be in early perimenopause if you have a space of, let's say, around 60 days or more between periods. You're experiencing hot flashes, sleep problems, you know, but it's tough, and I can understand how it was tough for this young lady, and I'm glad Acupuncture in My Life was able to help her, because having been diagnosed with fibromyalgia and then going into perimenopause, she would have never figured the exacerbation of her symptoms were attributed to perimenopause, but was so excited to find out she can benefit from acupuncture. Because we had a thorough conversation where I was explaining to her how her body was transitioning. And a lot of things when it comes to acupuncture, you know, it's not a one-size-fits-all. And we don't discuss treatment protocols in that likeness. You know, everyone's constitution is different. So there's so many ways an acupuncturist can treat an individual with perimenopause, undergoing perimenopause. But along with fibromyalgia, this young lady from Alaska coming to understand that acupuncture can treat fibromyalgia, she was astonished. You know, because the cause of fibromyalgia, let's say to an acupuncturist, can be due to an invasion of an external pathogenic factor, emotional stress, irregular diet, excessive physical work. I mean, the list goes on. You know, its pathologies can be due to, let's say, dampness, where an acupuncturist will look to resolve dampness. Or it can be due to chi stagnation or blood stasis, where an acupuncturist will look to move chi and eliminate stagnation, or invigorate blood to eliminate stasis. You know, fibromyalgia can also be due to spleen chi or spleen yang deficiency, spleen and kidney yang deficiency, liver blood deficiency, or liver and kidney yin deficiency. Or even if you want to look at it from a sick syndrome perspective, a Tai Yang syndrome, a Bentun syndrome, or a combination of other syndromes, there's many ways that an acupuncturist can diagnose fibromyalgia and treat it. It's all based on your constitution. So this is why I always say, go in and sit with your local acupuncturist or contact Acupuncture My Life. We're here for you. And this young lady, what she loved, because she took my advice and she went ahead one day because she was sitting up in her room, extremely fatigued and in a lot of pain. And she heard, listening to one of the Acupuncture My Life podcasts, when it was stated, close your eyes and say to yourself, acupuncture is my life. And then open it. And it helped her so much, just like it helps so many other people that have contacted us, that follow us globally. But I think it was a great suggestion that she'd made to speak on perimenopause with fibromyalgia, because yes, there are many women globally faced with this combination and don't know what to do, how to address it. Whereas seeing a doctor, it was suggested to this young lady to consider hormone replacement therapy. As well as cognitive behavioral therapy to address the anxiety, along with diet and exercise. These types of treatments you can get under one roof here at Acupuncture My Life, but not everyone has access to our clinics. Although we're expanding globally and we have affiliates that treat these disorders. I mean, we don't have a colleague in Alaska that we could have recommended to, but I mean, these forms of therapy, seek out an acupuncturist that's also well versed in Eastern nutrition, or contact us. We can change your diet for the better. Acupuncture is great for anxiety. In different exercises, Tai Chi, forget about it. Tai Chi works well for alleviating certain menopausal symptoms. And we teach that here at Acupuncture My Life. And quite a few acupuncturists can teach you Tai Chi as part of a wellness visit, or however they factor it into their model. You can request an acupuncturist to teach you Tai Chi, so you can do it early, like pre-dawn hours, and oh my gosh, it'll change your outlook on the day, your entire day. But I hope this podcast is able to help many women globally that are faced with this problem. Contact your acupuncturist as well as your doctor, and you'll be amazed. But for the young lady in Alaska, I mean, better late than never. I know, you're pretty upset that you could have addressed your fibromyalgia issues a long time ago, but it's not too late. And also noticing how much you can help other women globally, just even by asking Acupuncture My Life to discuss this topic over a podcast. Because we reach people on 7 different continents. So, I mean, kudos to your request. And I'll reiterate, download the Acupuncture is My Life app, everyone, so that you can engage in private chat sessions to learn more about how you or a loved one can benefit from acupuncture, as well as follow us on every social media platform, because we have so much information out there under Acupuncture is My Life that you can benefit from. But other than that, acupuncture is my life. What's yours?